Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Synalar Otic, a medicine also known as fluocinolone acetonate, lidocaine, neomycin, and polymyxin B. Synalar Otic is used to treat outer ear infection and also to reduce inflammation. If your ear is itchy, painful, or irritated, your doctor may prescribe this medicine. But how exactly does it work? Synalar combines several active ingredients. Fluocinolone is responsible for reducing inflammation, lidocaine numbs the area to relieve pain, and the antibiotics, neomycin and polymyxin B, fight the bacteria that cause the infection. It is very important that you use Synalar Otic the right way. The usual dose is a few drops in the affected ear 2 or 3 times a day. At first, the dose may be a little higher, and then it is adjusted according to how you respond to treatment. Remember to always follow your doctor's instructions. Like all medicines, Synalar Otic can have some side effects. The most common are temporary irritation and a little burning in the ear. If you notice anything more serious, such as an allergic reaction, see your doctor right away. Also, do not use Synalar if you have a perforated eardrum or a viral ear infection. In summary, Synalar Otic is a good option to treat ear infections and relieve pain and inflammation. Use it as directed by your doctor and pay attention to any side effects you may have. Protect the health of your ears. Thank you for watching this video, and don't forget to subscribe for more helpful information.
If you've made it this far, let us know in the comments why you're using this medicine.